help you. Here is your station. I don't have too much written on it, but whatever it is, you can imagine the rest with your knowledge of your traditional notes. And once you're ready, we'll begin.
Okay, ma'am. You can go ahead.
All right. So if you've read and understood, considering 8 communication skills station, please begin.
Yeah. Shall I enter the station?
Yes.
Okay, I'm entering the station. Hello, I'm Dr. Pinto. I'm the surgery resident on duty here. May I confirm your name?
Doctor, are you the doctor taking care of my child? Where is my child?
I'm the doctor who is working under the surgeon who's on the surgeon on in charge. Who's the surgeon on in charge today? So, ma'am, may I confirm like how you are related to your child?
I'm the mother. I'm the mother of the child. What happened to my child? Where is my child?
Right now, I understand your apprehension, but please try to listen. So what has happened is your child has been brought by the child's father, and right now your child is inside the operating theater. But regarding that, I need to explain you a few things. So if it's okay with you, can I explain about that?
No. You can't go ahead with the surgery. I have to see my child first. Who is the doctor responsible for my child? You can't just, without my permission, go ahead and operate on my child. No. You can't just do it.
Okay, so I really appreciate, understand your concern, but mother, the problem is your child was in an emergency. She fell down from the swing. Okay, so she was in a critical state, and that's why she was taken into the theater. But I would really want you to meet the child, but unfortunately, right now your child is in a critical condition. So it would be better that if you can listen to me, what I am trying to say. So if it's fine with you, I really want to explain a few things about the child. Is it fine with you?
Okay.
Okay, so right now the child has been taken to the theater. Before that, what we had to do is we found the child had suffered some tummy injury, and when we examined the tummy, we found that there is some bleeding that was happening from one of the organ that is within the tummy. So it is called spleen. So
Okay.
are you able to follow this? Yes. Can I proceed? Like what is
Yes.
the spleen?
Okay.
Okay. I want to explain what the spleen is. So spleen is a small organ that is located there in the left side of the tummy. Okay. So
Okay.
it is a solid organ, but it is found that there is a break in the spleen, and that is the main reason that the baby has the child has some bleeding that is there in the tummy, and as such, it has some immune function. The body it gives some defense to the body's mechanism, but the thing is, if we because of that reason, if you don't operate on your child, it might lead to progressive bleeding, and that might put the baby's life at risk. Okay, that is
My
the main
child will
reason.
die? Do you think, what are you saying? My child can die?
No, ma'am. I really won't go to that apprehension right now because you can be sure that your child is in the best safe hands. Your child is will be getting operated by the best surgeon possible who is available here. But we'll be taking much care to control the bleeding and do the best treatment that is possible. So I wouldn't want you to be worried about the child to that level as of now. But you can be sure that if we don't operate on your child, then definitely that will lead to some critical uh, things that can happen. But let's not be worried too much, and we can focus on the treatment that can be done better for the baby, right?
Okay, but how you people decided to operate on my child without my permission?
So the thing is, your child was after the child fell to his swing. The child was brought to the hospital by the child's father. So
Was he
we had to
drunk
check.
to give you permission like this?
Uh, yeah, but when he was, I'm not right now. I'm not sure whether the child's father was drunk when the child was brought to the hospital. But we had to take the baby for emergency surgery at the time of emergency like this. So we had to go with the father's consent as he was the person who was available. I'm really sorry that we couldn't get your consent before taking the baby to the theater. But right now you're here, and it would have been late if we didn't take the baby to into the theater early as possible. So I'm really sorry about your apprehension. But the best thing I can do is once a surgery is done and the surgeon comes out, I can make arrangements for the surgeon to talk to you directly. In that way, your apprehension will be made better.
How long is my child going to stay in the hospital?
So that regarding the details of it is going to take a few days for sure. But regarding all the treatments that is going to be followed, that really depends on the baby's condition and the level of injury that has happened to the baby's tummy that has gone inside. So depend all those details will be told to you much better by the surgeon who is operating. So I can really make arrangements for that. But right now, it will be too early to make a statement on that about how many days the baby will require the stay. But definitely, I can make you arrangement later for the doctor to talk to you about that. Is that okay?
Okay, when would I be able to take my child home?
So once the baby's condition can be made sure that the baby can be okay after going home without much risk of bleeding or without much risk of losing the consciousness or anything, any critical things that can happen to the baby. Once we can make sure, and some you or the baby's father, whoever is able to take care of the baby adequately at home, that we can make sure of that, then definitely we can discharge that baby. But right now, it will be too early to comment on that.
Do you think the consultant who is operating on my child is expert enough for this surgery,
Yes,
for this
because
procedure?
yes, mother, because we will not want any unexperienced surgeons to operate on your baby because this surgery really requires an experienced hand, and he has already been trained in so many of such surgeries before, and you can be sure that your baby is in the safe hands.
What precautions do you think I should take for my child to be safe after this procedure?
So after this procedure, the important thing that I am concerned about is there is a chance that baby can get frequent infections because the organ that we had removed from the tummy, like I mentioned earlier, the spleen is really concerned with the immune system in the body. That is, baby is prone to get infections if the spleen is removed. But the baby can be put on antibiotics that will be needed for a long period of time. But then you can make sure the baby doesn't go play into some dirty things or anything, any infections. You can make sure that baby doesn't come in contact with lots of infections, and you can make sure the baby gets a good recovery by giving the baby good food and taking care the baby doesn't strain on the body until the wound heals properly. And you can bring the baby to the hospital or to the GP anytime possible if some pain or some other complaint happens.
Okay. close, how would you close your consultation?
Okay, so is there anything else you want to ask me? Like, is there anything else you concerned about?
No, that's okay.
Okay, so let me summarize it for you. So your baby was brought to the hospital
Okay,
by
at the
the.
end, sorry, I have to interrupt you.
Okay.
At the end, once mother says it's all right, then you will give the consent form for mother to
Oh,
sign it. And please, it's 10 years old, 10 to 12 years old patient, child's age. So baby
okay.
is under the age of 12 months, you know. This
Okay.
is a child, yes. So,
So,
yeah. Okay,
so
so if mother says yes, then you will give the consent form to the mother to sign it. And with this,
okay.
your time is finished. So this
Okay.
session,
Okay. So
you don't
I'll.
have to summarize it here.
Okay. Okay.
Good.
So I'll just get the consent form signed by the mother. You
Yeah.
can please
If
sign
she
the consent.
says he does not have any more questions, then that means all right. What happens actually in this scenario, the husband and wife are separated or divorced. It's
Okay.
her ex-husband and she has the legal custody of the child. So she's the legal guardian of the child. He has full
Okay.
custody because father is a drunk and father does not has lost his custody of the
Okay.
child. But by law, he has the right to meet or see the child. So that's how father came in contact with the child and brought him here. What you have to say that when mother is saying, was the father drunk and etc., then you have to discuss about the child's issue with the extra precaution, with the child uh, social services,
Okay.
so that you can take the consider the situation of the child at home and you can protect the rights of the child by involving the social services. Good.
Okay. Okay. So
That
I
yes,
can say that I can involve the social workers to take care of the baby conditions at home, or
take care of the child, your child.
take care of
Or
your
if
child.
the name of the child is given in the
Yeah.
stem, Adam or Tom or Robert or whatever, then you have to
Yeah.
mention the name of the child. Okay.
Okay. Okay.
Alex, then you can't say baby or the child. Then you have
Oh.
to mention the name of the child. Your
Okay.
child,
Okay.
Alex, your child, Tom, your child, whatever. So yes,
Okay.
you're absolutely right. And then when mother was asking about the discharge and all, then you have to tell about the functions of the spleen as well, that okay, what child will lose and how, what are the functions which are going to be affected. And yes, you told about the antibiotic, very good, and the complications, and then post operatively post splenectomy, you have to explain those. Good.
Okay.
And maybe when you are explaining the pain in the beginning that this organ gets injured, maybe you can get a piece of paper and a pen out and you can draw an abdomen and you can locate where exactly spleen is located. You can draw it in front of the mother in order to make her understand the injury or the organ which has been injured more better.
Okay.
This you can add in your revision. Good. And in the beginning, when mother is saying, are you the doctor who is taking care of my child? So it was your second sentence, but then you can maybe, you can realize it and you can make it maybe your first sentence. Can I confirm what is your relation with the child X, Alex or child Tom or whatever? And she'll say, I'm the biological mother of the child. So good.
Okay.
Good. Thank you.